Hello. During the next few minutes, we're going to explore various aspects of orthognathic surgery. The purpose of this video is to help you understand a method of treatment that might be right for you. And because no procedure is without possible risk or complication, we'll inform you of the potential risks or complications associated with your treatment. Now, let's explore these areas in more detail.
The term orthognathic is derived from the Greek words orthos, meaning straight, and gnathos, meaning jaws. And when jaws and teeth are out of alignment, or if they're too large or they're too small, a corresponding facial imbalance can result. The goal of orthognathic surgery is to bring the jaw and the teeth into proper alignment to create better jaw function. Orthognathic treatment requires a close working relationship between two specialists, an oral surgeon plus an orthodontist. The orthodontist straightens and aligns the teeth with braces, and the oral surgeon, and this can happen during orthodontia, repositions the jaws through corrective bone surgery. A patient's suitability for orthognathic surgery is determined through a thorough workup performed by an oral surgeon and an orthodontist. First, the oral surgeon and orthodontist conduct a comprehensive examination and make detailed records of the patient's medical history, bite and jaw movements, and temporomandibular joints. They may also take special X-ray films of the patient's skull and face, as well as photograph the patient's face from various angles. We may also take plaster study models to help plan final bite results. As part of the diagnostic workup, the oral surgeon sometimes utilizes a computer to project possible surgical results. These records help to indicate whether braces alone can correct bite problems, or if orthognathic surgery is a treatment option. When orthognathic surgery is indicated, we then conduct further analysis. This may include study models mounted on a device that mimics the patient's jaw relationships. The oral surgeon performs mock surgery on the models to determine the potential success of the actual surgery. When the orthodontist and the oral surgeon have agreed on a treatment plan, we communicate the information to the patient in careful detail. Patients are encouraged to ask questions and seek additional information so they understand and agree with all aspects of the proposed treatment.
I'd been thinking about doing something about my bite problem for a long time. My oral surgeon and orthodontist explained the benefits and risks associated with the surgery, and they encouraged me to ask questions, and I had lots of them. Mainly, I wanted to know how long the treatment would take and what kind of results I could expect.
Elaine, it's important for you to understand that orthognathic treatment requires long-term commitment. And it's equally important that you have realistic expectations about the results. Now, as much as possible, the oral surgeon and your orthodontist will keep you informed about the duration of the treatment and the likely end results. And if you commit to the proposed treatment, we initiate the orthodontic phase. And during these months, the orthodontist applies braces and positions your teeth for the bite that will result after surgery. And throughout the orthodontic phase of treatment, you'll make regular visits to your orthodontist. And during these checkups, the orthodontist adjusts your braces and monitors the progress of your treatment. Now, to maintain good dental health, you'll also need to make regular visits to a general dentist for cleaning and checkups. And when the time for surgery approaches, we may create new study models and perform another mock surgery to confirm that the desired results can be achieved through surgery on either the upper or the lower jaw, or maybe a combination of both. In lower jaw surgery, we separate the bone behind the teeth and move the tooth-bearing portion either forward or backward to achieve the planned bite. Except in special cases, the oral surgeon makes incisions inside the mouth, so no scars appear on the skin. Now, in upper jaw surgery, we may move the jaw forward or backward, as well as shorten or lengthen it vertically, depending on whether too much or too little of the front teeth show beneath the upper lip. Now, in your case, I think we're looking at a fairly straightforward procedure, but we always conduct this type of procedure under general anesthesia, and this means you will not be conscious during the surgery.
Well, there must be risks.
Well, yes, there are, and I want to go over the risks with you in some detail. So please stop me whenever you have a question or need further clarification. Now, the risks of general anesthesia can include nausea, vomiting, nosebleed, tooth damage, hoarseness, prolonged recovery, and pneumonia. And as with any general anesthetic, it may be potentially fatal.
So far, we've reviewed the diagnosis, treatment, and alternative treatment of this surgery. No surgical procedure is without risk, so we want to make sure that you're also informed about some of the complications. Your oral surgeon will explain these risks to you prior to surgery. You'll be asked to sign a written consent form to signify your understanding. If you have questions or need further explanation, always be sure to ask.
Elaine, I feel it's important that you understand some of the complications associated with your surgery. First, there is the risk of infection. In any surgery, bacteria are always present and may cause infection. However, infections usually respond to antibiotic treatment. In cases of severe infections, prolonged treatment or hospitalization may be necessary.
Are there any other complications?
Depending on the difficulty of the surgery, there are a variety of risks. Now, besides swelling and bruising of the face and jaws, risks can include damage to tooth roots, which may later require root canal treatment or result in loss of teeth. Now, before I continue, do you have any questions?
Well, yes, I was wondering if I'd have to have my jaws wired.
Well, in many cases, we can firmly fix the bones with tiny screws or metal plates, and your jaws may be held together for only a few days. And in other procedures, we may need to immobilize your jaws for a number of weeks to facilitate proper healing. And in rare cases, this can result in lasting gum and tooth problems. And if your jaws are fixed together, you will also be required to go on a liquid diet. A complication associated with surgery in the lower jaw is the possibility of nerve damage. The surgical site is usually very close to several sensory nerves that run through the jawbone. This nerve can be injured during lower jaw surgery, leaving patients with pain or tingling or a numb sensation in their lip, chin, gums, teeth, or in some cases their tongue. This sensation, which is similar to the effects of Novocaine, can last for days, weeks, or months. In rare cases, the condition is permanent. Surgery in the upper jaw also bears the risk of complication, since the surgical site involves the sinus cavity. This may lead to a sinus complication that requires additional treatment, usually with antibiotics, but sometimes will require additional surgery to repair. In some cases, the jaw bones take a prolonged time to heal. The bones may be joined together in the wrong position, requiring corrective surgery. The new bite position may affect the function of the jaw joints, causing discomfort, clicking, and chewing difficulties. And since jaw surgery has a potential for significant bleeding, patients may wish to donate their own blood for later transfusion during their own surgery. After an appropriate period of recuperation, the orthodontist will begin to move the teeth into a refined position to finish the bite as originally planned. After the teeth are in position, the orthodontist removes the patient's braces and inserts a retainer. Approximately 12 months after surgery, facial tissues will have adapted to the new underlying tooth and bone position, and final results can be anticipated. It is of utmost importance for patients to tell their doctor what they're expecting before undergoing surgery, so that the oral surgeon can provide a realistic picture of the final results. Informing patients of the risks associated with dental surgery allows them to make decisions about their treatment.
Before we close, let's take a few moments to review some questions that many patients ask. True or false? Improperly aligned teeth are often accompanied by a facial imbalance. This is true. In some cases, this condition can be corrected through orthognathic surgery. Orthognathic treatment uses the combined skills of an oral surgeon and an orthodontist. Is this true or false? This is true. True or false? In some cases, braces alone can correct a bite problem. True. In some cases, braces alone can correct a bite problem, making orthognathic surgery unnecessary. Orthognathic surgery may be performed under local anesthesia. Is this true or false? False. Due to its complexity, orthognathic surgery cannot be performed under local anesthesia. General anesthesia is always required. Is the following statement true or false? A risk associated with this surgery is damage to the sensory nerve in the lower jaw. This is true. Please consult with your oral surgeon if you'd like further explanation of any of the information in this video, or if you have questions about topics that may not have been included. During the informed consent process, you'll be asked to read and sign a surgical consent form for the procedure just described. Your oral surgeon is committed to not only caring for your physical needs, but also to providing all the information you need to make an informed decision about your course of treatment.